I'm Jane Duncan. Well, I'm a nurse of 50 years. My hospice journey began when my husband became very health conscious. I think he felt like something wasn't quite right, and he began to ride the Doodle Trail from Pickens to Eastleigh to stay healthy. He lost, 60 pounds, and that was his love, was riding. And he was hit by a car on the Doodle Trail, which resulted in a head trauma. What we did not know was the head trauma was like throwing gas on a fire when it came to dementia. And it really began his journey of dementia, which led to hospice care. And it probably in 2020 was my worst year without hospice. Everything shut down, and I was alone with a husband who was combative, violent. He injured me several times. I survived, and finally opened up to my family. And they were really stressed out during that time, and they didn't need my troubles, is the way I looked at it. My son, the doctor, on the phone said, "Mom, I suggest that we call Hospice in the Foothills. I understand that they are a 5-star agency, and I've heard nothing but wonderful things, and I want my dad for them to come and evaluate him." So it was there that I met Dr. Myers. He came to my home with the nurse. He kept my husband the center of attention and the center of patient care. He respected my knowledge. He allowed me to be the caregiver. The nurse was wonderful. And she kept up with all the medicines. I was administering his medicines, of course, and my personal care aide was very scheduled. She gave me structure to my life. I don't know that I asked for a volunteer, but one day my phone rang, and she said, "I'm Helen, and I'll be coming to your house tomorrow. I'll come after lunch if it's okay. And I'm going to sit with Ron, and you can go have coffee. Go meet with your sister. I'll be there until a certain time." She came every Thursday, and it gave me that break that I needed. So my request was that my husband would not pass it. He would not die and be in my home, because I had to live there afterwards. So when the nutrition became difficult, his swallowing, I realized it was time to come to Cottingham. So we transported him, knowing that he wouldn't come home. And we began a journey. You see, my husband and I had traveled around the world together. But this was one journey that he would make alone. Cottingham knew Ron because we had used your respite program. They knew our names. They loved us. They knew how to take care of Ron when we came in for the end of life care. And that was special. If you're wanting to make a difference, I think in donating to hospice that, you're making a big difference in how someone ends their life and the support that they need.